Okay, perfect. Well, thank you everyone for joining us for our second Healthy Utah Community webinar. Before we really get started, I just wanted to go over a few introductory things just to begin with. So first of all, just to give you some context, this is, like I mentioned, the second Healthy Utah Community webinar that we've hosted. So these webinars are part of a larger Healthy Utah Community Learning Network that we are starting just this year. So these webinars are going to be monthly. We held one in January. This is our second in February. And then we are planning to do our next webinar in March on Wednesday, March 8th. And the topic of that webinar is going to be tips to build health coalitions for your community. So if you're interested in signing up for our next webinar next month, in a little bit here, I will drop a link into the chat that you can register with. And also we will be sending out that link in the follow-up email that we are sending to everyone who registered. So just so you know, that follow-up email can be expected before the end of the week. It will include a recording to today's webinar, a link to sign up to next month's, as well as just some additional information about the Healthy Utah Community designation. So that's the other thing that I wanted to remind everyone about, is that the next application deadline is coming up very quickly. So if you want your community to be designated a Healthy Utah Community this spring, that deadline is only 2 weeks away, March 1st. So if your community has been working on the application, just make sure that you complete that and email that to Get Healthy Utah within the next couple of weeks. And if you need additional time, you're welcome to let us know, but also we do have another application deadline later this year in the fall, which is August 1st. So if you're interested in the designation, but just need more time, you can also plan to apply in the fall. And then also, I forgot to mention that we are asking everyone for some feedback on the Healthy Utah Community Learning Network that we are creating. So again, in a moment here, I will drop a link to a survey where you can give us feedback on this webinar, on social media presence, about all of the different resources that you would like to receive as you work towards the designation or work on maintaining it. So we just ask, if you haven't completed that survey already, to please be sure that you do that. It is extremely helpful to all of us. And so with that, we can go ahead and get started now on the meat of the webinar. So today's topic is, how healthy is your community looking at the data? I did want to provide a little bit of background on why this is important and how it applies to the designation. So let me just share my screen here. If you're familiar with the designation, you'll remember that there are four requirements to be designated. First of all, you need to submit a letter of commitment from your mayor or city council, organize a community health coalition, implement health strategies, and then last of all, develop a community health plan. And this is where today's webinar comes into place. Because in the community health plan, what we ask you to do is we ask you to look at the health data for your city or town. And we provide two resources to do that. The first is the Utah Healthy Places Index, and the second one is IBIS. And then after looking at the data, we ask you to answer a few essay questions, and then, depending on what weaknesses that you saw, determine what health strategies you want to work on for the next 3 years. So today we are going to be talking about specifically the Utah Healthy Places Index. And all of us are pretty lucky because we have Sarah Hodson here to talk about the index for us. Now, some of you might be familiar with Sarah. She was actually the executive director of Get Healthy Utah for a lot of years, and was actually one of the individuals who helped to start the Healthy Utah Community designation. So she's very well versed in it, understands it really thoroughly. But then on top of that, she has since moved on to bigger and better things at the State Health Department, and is now working as the Deputy Director of the Office of Health Promotion for the Utah Department of Health and Human Services. And in that role, she was actually one of the, you can say, leading experts who helped to bring the Utah Healthy Places Index here to Utah and get the website up and running. And so with that introduction, I will go ahead and pass it off to you, Sarah, to take it the rest of the way and tell us a little bit more about the tool.
Thank you, Morgan. I'm going to share my screen and hope we don't have some technical difficulties. Can you tell me what you're seeing, Morgan?
Yeah, let's see. We're seeing your PowerPoint. It's not in presentation mode, but we do see the slides.
Excellent.
Okay, now it's working.
Better? Okay. Well, I'm really happy to be here and to be talking about the Healthy Places Index, which is near and dear to my heart, and also just so happy to always have the chance to work with Get Healthy Utah. I realized as I was sitting here, I have my Get Healthy Utah mug right next to me. So I'm happy to be here to talk about that. So just a little introduction. I'm Sarah Hodson. I'm with the Office of Health Promotion and Prevention at the Department of Health and Human Services. And there we go. We started a process of developing the Utah Healthy Places Index about a year and a half ago, and worked with a number of different partners on creating an index that was relevant to Utah, that had Utah data in it, and also it includes a policy component, and we wanted to make sure that policy piece was relevant to Utah as well. So here's a list of some of the partners we worked with in the development of the tool. We contracted with the Public Health Alliance of Southern California, and our Healthy Places Index is modeled after the California Healthy Places Index. And this whole project was funded by an Overdose Data to Action grant from the CDC. So we worked with these partners through stakeholder meetings and different engagement exercises for about a year as we developed the Healthy Places Index. So why were we interested in this? So we understand as a public health agency the role that community conditions play in people's lives. So the areas where we live have a significant impact on our health outcomes and even our life expectancy. And so as we look at the option of quality education within a community, of affordable and safe housing, housing that's free of toxins and other allergens and other dangerous conditions, whether or not a community has access to healthy foods, are there places to incorporate safe walking and biking for members of the community, is there access to adequate healthcare? And is there a sense of community connection and a social cohesion within a community? And all of these things impact people's quality of life and their well-being and their health outcomes. And it's the vision of the Department of Health and Human Services to ensure that all Utahns have fair and equitable opportunities to live safe and healthy lives. And we really can't do that if we don't have an understanding of the conditions where people live in Utah. So the Healthy Places Index helps us to have an understanding of community conditions and then provides us with some policy opportunities to make changes. So there's lots you can do with the Healthy Places Index. Here's a list of things here. Because of the time that we have together today is relatively short, I'm only going to show you a couple of these features, but I would recommend that you take some time to get into the index yourself and explore and try them out and see all of the different indicators. So I'm just going to kind of give you a sneak peek today and then really take some time to explore on your own. The website listed at the bottom, and I'm not looking at the chat, but maybe Morgan could put it in the chat as well, is where you access the information about the Healthy Places Index and then can access the map from there as well. So that's what we are going to do. I'm at a different, not my normal desk, and I have a different mouse, and I'm clearly struggling to get the mouse to work. So I just wanted to highlight, as Morgan just showed you, how this connects to the Healthy Utah Community Designation Program. So if you're here wanting to learn more about how you complete your application, the Healthy Places Index is one of the data sources that you can use. And it will also help you answer these two questions. What factors influence aspects of health and what demographic groups? So if you're filling out the application, the information that you'll learn today will help you do that. If you're not filling out an application and not here as part of completing this application, that's still really useful information and provides you some great resources to learn more about your community. So we are going to get into the website. Are you seeing the website now, Morgan? Okay, so this is the landing page. It's on the Department of Health and Human Services website. And if you click, I just want to highlight one place before we get into the map, which is this Learn More section. In here, there's a number of really great resources. And as I said, we're only going to look at a couple of the features today. So this is a place you can come to. And we have training videos on the different tools and resources. These are like 5 minutes long, something like that. There's tip sheets where you can get PDFs of the different features and functions. And then there's a really robust frequently asked questions section. So I would recommend going here first and getting just oriented to the map. But we're going to click into the map so I can show you some of the tools and features that are here. So as you get into the map, the default is you see the full state of Utah, and we see it by census tract. This is the HPI score, and the HPI score is a composite measure of 20 different indicators related to the social determinants of health, and I'll show you more of what those are in just a minute. So each, in this case, we're looking at census tract. Each census tract falls within this blue to green color scale, which indicates dark blue being less healthy community conditions and dark green being more healthy community conditions. You can also adjust the geography that you're looking at. So maybe you're more interested in looking at a comparison across counties. So you can see I switched to counties. Maybe you're doing some work, it's the legislative session, and you're interested in looking at some legislative districts. So you can see there's a number of geographies you can choose here. For our conversation today, I'm going to click cities and towns. I think that's probably most relevant. And you can see most of Utah is not a city or town, but as we scroll in using this button, and this map features just like any others where you're kind of clicking and scrolling and zooming in. And I'm going to use some of the communities that have already received the Healthy Utah Community Designation as examples today. And this is just for demonstration purposes. So I'm going to start with Spanish Fork. So if I click on Spanish Fork, you can see this community conditions panel pull up on the left here. And what this tells us is what are the community conditions in Spanish Fork? So the HPI score is 49.6, which tells us that Spanish Fork has healthier community conditions than 49.6 of other Utah cities and towns. So it's making a comparison across cities and towns in the state. And Spanish Fork is just kind of right in the middle. But what we learn as we scroll down is where does this community fall across the 8 different areas that make up the score? So what you can see is some variation, and you'll see this in every community. There are places where this community is doing better, like in healthcare access and economics, and places where there's room for improvement, like the neighborhood conditions or education. And so it helps you to get a sense of what's happening within your own community. Each of these, as you can see, has a drop-down box. And when I click that, I will see the specific indicators that make up the score for this section. So the education section comes from 3 indicators: bachelor's education or higher, high school enrollment, and preschool enrollment. So again, you can see in Spanish Fork, there's a variation there. They have a higher level of bachelor's education, a higher level of high school enrollment, but a lower level of preschool enrollment. And so that helps us to see more detail about what's happening in that community. So we can see if we wanted to improve education, what we might want to start out with in this area is preschool enrollment, because that's where we're lower than the rest of the state. So again, it helps you to prioritize and see more specifically what's going on. You can do that with each of these sections. I'm just going to scroll and show you. There are 20 indicators across these 8 categories, and you can take more time and explore each of those for your own city and town. For each of the indicators, there's a little right arrow next to it. And when you click on that right arrow, you learn more details about that particular indicator. So it reminds us at the top what we're looking at. We're looking at bachelor's education or higher. It tells us here in this panel, a comparison for Spanish Fork as a city, for Utah County, the county that Spanish Fork is in, and for the state. So I want to point out that you'll see 2 numbers here. So the number on the left is the actual value. So 31.3% of people over the age of 25 in Spanish Fork have a bachelor's education. And the number on the right is the percentile ranking compared across the state. So 31% of adults have a bachelor's education, but that ranks in the 65th percentile for the state. So it's doing fairly well across the state. Utah County has 40%, a little more than 40% of adults with bachelor's education, and that ranks 96th percentile across counties. So Utah County is very high in terms of bachelor education. So just to make sure there's an understanding of what these 2 numbers are. As you scroll down, you'll get some really important information here in this, what is this connection? What is the connection to health section? And what that tells us is how bachelor's education, that's what we're looking at, is connected to health, because it might not be clear. You may be asking, why does the Department of Health and Human Services care about bachelor's education? What does that have to do with health outcomes? So it gives you a little bit of text and context for why we care about bachelor's education, and you can learn that for all of the 20 indicators that are part of the score. There's a section below that that will link you to policy opportunities specific to bachelor's education. So if you identify that that's an area that needs improvement in your community, there's some potential solutions in this policy document. And then below that, it tells you, again, what actually are we measuring, so we can remember what is it we're looking at, where does the data come from, and then what are the years of data. Most of the data are 5-year aggregate in order to get down to the census tract level. So that panel of information is accessible for all of the indicators that are listed here in this community conditions panel. So again, I would just advise you to take some time and explore and learn more. So I am going to scroll north, and we're going to go to Provo, which is another designated community. And when I click on Provo now, my community conditions panel has adjusted, and now we're looking at the scores for Provo. But I want to show you another feature that may be useful for those cities and towns that have more than one census tract. So cities and towns with a small population may only be one census tract, but most of the cities and towns in the state will have more than one census tract in them. And if we change our geography from cities and towns to census tract, so you'll see the map changes. Now we can see that we can see more of the variation across Provo. So now Provo is not all one color. We can see that there's actually some differences between neighborhoods. So some of them are in this green color, more healthy community conditions, and some kind of the central Provo area are in the dark blue, meaning less healthy community conditions. So that helps you to distinguish even more within your own community some of the differences by neighborhood. So now we're looking at neighborhood level data rather than city level data. So I've clicked on this Western census tract in Provo, and you will have noticed that the panel on the left has changed. And now we're looking at this specific, and I'll zoom in so you can, maybe if you're familiar with the area, you can see how detailed the map can be for you to see kind of the streets that are in this particular area. It tells us in the panel the population. And then again, it's the same 8 categories and the same 20 indicators below those categories so that we learn more about that. So if I were to dig into housing, I learn in this census tract that this housing has healthier community conditions than 32.9% of other census tracts across the state. So now we're comparing to census tracts rather than cities and towns. And again, we can see some variation across the housing indicators in this particular area. So we can see that there's a burden on low-income renters. And if I click again on the right, I get the details about this particular indicator. So I learned that I'm measuring the percent of low-income renters who pay more than 50% of their income on housing. And then I can see the comparisons for the census tract, the city, the county, and the state. Just a note to remember that when we're looking in census tract, that we are learning information and data only for that census tract. So not for Provo as a whole, only for this particular neighborhood. So this helps us to get comparisons across neighborhoods within a city and town. But remember, the data is only applicable to the neighborhood that we're looking at. I want to show you one other important piece of the community conditions panel, and that is at the bottom. If we scroll down, you can see this health and racial equity section. And what this tells us is the race and ethnicity demographics for this, in this case, this neighborhood that we're looking at in West Provo. And what we see is that 25.5% of the population identifies as Hispanic or Latino. And if I click that drop down, I can learn country of origin. This information comes from the census, and the categories are determined by the census as well. So this is really helpful for that demographic piece if you're filling out the application or if you want to learn more about your community. It's also helpful if you're trying to target where would be good places within the community to have language, things translated into the appropriate language for the members of the community that live there, or what community groups maybe to work with so that you're doing culturally appropriate programming in these neighborhoods. So this panel gives you just more information about the demographics in this particular community. Okay, I'm going to show you a couple other features. One is, so we've been looking in the community conditions panel, which has the HPI score, and that includes 20 indicators that make up the score. But the map includes actually 350-ish indicators. So there's a lot more information than just those 20. So I clicked on tools, view indicators. I'm going to scroll past the ones we've already looked at a little bit and go into this section called decision support. And within decision support, there are a number of categories. So again, just take some time to explore within here to learn more. But I'm going to pick a couple that are part of the emphasis of Get Healthy Utah. So in health risk factors, there is a measure of no leisure time physical activity. So this is essentially people who get no physical activity. So you will have noticed that the map changed from a blue to green scale to a blue to purple scale. That's to help as a visual reminder that we are no longer looking at indicators that make up the score. We're looking at indicators that just provide additional context, something else we might be interested in learning about this community, but it doesn't impact the score. The other thing to make note of when you're in this blue to purple is that the scale is a less to more. So sometimes more is good, like broadband internet access, for example, more would be good. Sometimes more is bad, like what we're looking at here, physical inactivity. We want less physical inactivity. So just orienting yourself to what you're looking at. So I'm going to highlight another of the communities in the Healthy Utah Community Designation. And I'm going to show you a feature here. You could search an address, but we're going to go to Heber. So it's going to just zoom us in the map over to Heber City. And when I click on Heber City, I can see the panel that gives me more information about no leisure time physical activity in Heber City. So I see how that compares to the county. It's very similar, and to the state, slightly better, slightly more physical activity than the state. It gives me, again, the definition of what we're looking at, where the data comes from, and the years of data. So for these, what are called decision support indicators, you'll get a similar panel of information that tells you the value, the percentile ranking, what it measures, and where the data comes from. And as I said, there are lots, there's hundreds of indicators in this section. One way of maybe finding them a little easier is there is a search function. So I'm going to put in food. Healthy eating is another priority of Get Healthy Utah. And so we might want to be interested in looking at food insecurity. So I'm going to click food insecurity. And then you'll notice that the map automatically changed to counties. So for some of the indicators, all the geographies are not available. And that's true for food insecurity. So you wouldn't be able to look at it as city or town, that data is not available. But the map will automatically update for you so that you can see what geographies are available. I'm going to scroll out so we can see a comparison across the state. So sometimes you may only find data available at a county or another maybe local health district level, but you can still get a sense of what's happening where you live for this data as well. Okay, I want to just quickly show you maybe one of the advanced features and then leave time for questions. So one tool I always use is refreshing in this top box, because sometimes I get caught up in like, where am I in the map and what layers have I put on there? And so I just refresh so that I don't confuse myself too much. So one feature I think may be useful is a ranking feature. So that's a tool you can find in this tool sections, rank geographies. And I want to rank census tracts, and I'm going to move to the northern part of the state in Logan. So the map just zooms me up to Logan, and I am ranking census tracts in Logan. There's, I think, 9 here by HPI score. And maybe I'm only interested in comparing them to Logan, not to the rest of the state. So I click this button here and you can see the rest of the state's grayed out. I don't care about the rest of the state. I'm only interested in Logan. So now I'm looking at these handful of census tracts in Logan, and I can rank them by HPI score from highest to lowest, or if I click the arrow here, from lowest to highest. So I get a sense of within Logan, where are the areas I might want to prioritize my work and my time. You can rank with any of the indicators. So if you're specifically looking at physical activity or maybe diabetes rates or income or housing indicators, and then you can rank within your city and town by census tract and get a sense of where there are areas where things are going really well, and maybe you can figure out some lessons learned in those areas, and where there are areas where there's some need for improvement. So this ranking within your city and town, I think, is a helpful tool to get a sense of what's happening across the city and town. I just want to show in the tools menu, and we won't click on these, some of the other features. There's filtering, where you can set criteria of the indicator that you want to look at. There's comparisons. You can compare 2 maps side by side. So you may be interested in looking at 2 indicators maybe education, and maybe one related to income, and look at them side by side and see where you can see some comparisons. You could pool if the geographies in the drop-down box don't meet your needs and you want to look at create your own. You could pool some areas together. There's also uploading and downloading data features as well. So I'm going to stop there. I have not been looking in the chat. I don't know if there's questions in the chat, or Morgan, how you want to address any questions people might have.
Yeah, perfect. Thank you, Sarah. So we don't have any questions in the chat. So if you do have questions, you're welcome to drop them in the chat right now, or you can also just raise your hand or come off of mute and we'll address them one by one. I know we did say that we would end the webinar at 12:30. So if you need to hop off right at 12:30, that's just fine. We do have some flexibility in time, though, that if there are a lot of questions, we'll just keep the recording going and we'll go as long as we need to address most of the questions.
I'm going to pull my slides up again just so you can see finally the the generic email address is ohpp@utah.gov. So if you have questions, you can email us. If you want additional training or presentations, we're happy to do that. We can do technical assistance calls where if you want to understand a feature better and you don't understand, maybe have some questions about the data in your area, we're happy to schedule a technical assistance call to help work through that. There's also a contact us form on the frequently asked questions page of our website, and you can fill out the contact form. It all goes to the same place, which is to me, so I can access any of those. And then I will also say a lot of our local health department staff have been trained in how to use the Utah HPI. So if you have a relationship with your local health department and there's someone at your local health department you work with, you could talk to them about it as well. Many of them have gone to the trainings and learned how to use the tool, and they're a great resource as well. So feel free to reach out to your local health department if you need more information about data locally.
Awesome. Thank you, Sarah. So let's see, it looks like we have one question from Luann from Holiday. She asked, are you tracking how often this information is being accessed or by whom?
We wouldn't know by whom, but we do have data, but have both just the Google Analytics for the website, but we also have analytics for the mapping page. So we know which pages people go to. We don't know the specific indicators people access, and we don't know who they are.
Thank you. Let's see, that was our only question in the chat, and it doesn't look like I see any hands. So I'll give it about 15 seconds if anyone else has something they'd like to ask. Okay, perfect. Well, I'm going to take that as a sign that you did a really great job explaining, Sarah. So we definitely appreciate that you came and gave up some of your time this afternoon to train us on this. So like I said, we will send out the link to everything I dropped in the chat in the email follow-up, as well as the link to the Utah Healthy Places Index. So just like Sarah said, this is a really robust tool, and the more time you spend in it, the more you'll get comfortable with it, the more features you'll find. And if you do need help or have questions along the way, definitely feel free to reach out to Sarah or to Alicia and I at Get Help Utah, and we're very happy to help you where we can. All right, so great. Well, thank you, everybody. Keep an eye out for that follow-up survey, and we will probably see some of you at our next webinar in March. So thank you very much.